Hi, my name is Walter, and I'm going to be showing you how to change a central line dressing. The first thing you want to do is check the doctor's orders, make sure that that's what is asked for. As always, we're going to wash our hands before any procedure. We're going to introduce ourselves to the patient, and then we're going to check for 2 forms of ID on the patient. Okay, we're going to give the patient privacy. Okay, next, we're going to raise the bed to walkable height. Okay, for this procedure, we have to make sure that you are wearing a mask and also your patient is wearing a mask. If you don't have an extra mask for the patient, you have to let them know to tilt their head to the opposite direction of the central line dressing, and they can, just so they don't cough or breathe in the field. Okay, so the first thing you want to do is remove the old dressing. Once you're removing the old dressing, you're going to assess for phlebitis, for any kind of filtration. We're going to assess for any kind of irritation on the site. For that, you're going to use clean gloves. Okay, so we're going to remove the dressing that they already have. We're going to discard it. Okay, and we're assessing for, like I said, phlebitis or irritation around the area. Since it's clear, we're going to proceed to change the dressing. So we're going to remove these gloves because we're now going to set a sterile field up. Okay, so you're going to start by opening your sterile field. Okay, you're going to use sterile gloves. Okay, so the first thing you want to do is use the bread brush. You're going to pop until you hear you're going to squeeze until you hear a pop. Okay, and then you're going to brush horizontally and vertically as well, but away from the site. You're going to do it vigorously. Okay, and you're also going to clean the lines. Okay, we're going to discard of this, and we have to let it dry. After we let it dry, we're going to use the bio patch, which is not in our kit, but we're just going to pretend that we do have one. We're going to apply the bio patch. Okay, and then we're going to apply the Tegaderm transparent patch to it. We're going to apply it on the patient. Okay, we also have to make sure that we are labeling the date, the time, and also your name once you put the patch, which is included in your sterile field. So we're going to have our date and name and time ready, so we're going to put it on the patch. Okay, once you're done, you're going to just put the gown back on the patient. Going to lower the patient to a comfortable height again. We are going to remove our gloves, discard, remove our mask, okay, and as usual we're going to document everything that we just did, and that's how you change the central line dressing.